I want to bring my good friend to the show, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. And Joe, 90-degree temperatures. I've been seeing a lot of the kids out training for the cross-country season upcoming. I know football and all the fall sports really kick in as of Monday. And not to be put aside, a lot of the band camps and the bands are practicing and marching out in that heat. And we got to really pay attention to these high heat days.
Yeah, August 1st falls on a Monday this year. It's right about in line. It's the first official day for the majority of fall activities and fall sports. And I am concerned as you look ahead in the forecast, another very hot week next week. We've had a lot of heat, so maybe some of our athletes that have been out in it would be acclimatized to some extent. But a lot of kids, for whatever reason, wait till the last minute. It's the first they're out in this heat, and the heat is just really brutal at this time of year. And so we need the coaches and we need the athletic trainers to be aware of it. The trainers are great. They understand. The athletic trainers in the high school setting really understand what we're up against. But it still is, Ray, and that's why we need to talk about it. One of the top 3 causes of death related to sports is heat illness, and we will again this year, as we do every year. We'll have a couple kids succumb to that. So it's worth at least talking about to give you a heads up as to what could lead to that type of a problem.
Let's talk about high heat, and I know there are different stages to be very critical of. So why don't you go down that road for me?
Yeah, the trainers are really good. There's actually a combination of a heat index with heat and humidity, and they look at a wet bulb globe temperature combination between humidity and heat to make recommendations on what time of day kids should exercise in and whether they should have the heavy equipment on and other things like that. 13 states have passed legislation about acclimatization policies for sports, Ohio being one of them. So we have that 5 days that you have to practice before you can put equipment on. Even if you're somebody who comes to this late, a kid who's been sick or a kid that's been injured still has to go through those 5 days before they're able to put the equipment on. And there's several other parts of that policy. But I also want to talk about kind of what you might expect. There is kind of a lead up to this. So with heat illness, we get to the life-threatening when we get into heat stroke.
Yes.
But many times you can pick this up with cramps and exhaustion, which is the step before, where we're not into full-blown heat stroke. When we're into full-blown heat stroke, we need to call 911. We need to cool these kids as quickly as we can. One little trick that a lot of the trainers around the area, I go to different camps and see these things, do is they get it's a perfect size for it, the baby pool out of the backyard from somebody, and they fill that in a shaded area with ice-cooled water. And if they have somebody overheating, if they have somebody getting up to that 105-degree core temperature where they may get into heat stroke, you put them in there and you rapidly cool them as fast as you can. Throw them in the pool, put ice on them, put a fan on them, and make sure you get that temperature down as quick as you can. We have about 20 to 30 minutes. If a kid is in heat stroke over 30 minutes, that's where we can get into things like brain death and other issues. So sometimes this becomes an emergency, a 911 call, but we want to pick it up sooner when kids are having the signs of heat exhaustion or cramps.
Yeah, and to commend a lot of the coaches. I know a lot of the coaches now have pushed those practices back to 3-4 in the afternoon, and that's a job well done in these heat times. But for parents and some of the grandparents and stuff, the kids are out there working out during the day. Warning signs, obviously getting dizzy a little bit, Joe, is one of them. But talk to them about the warning sign, those preventative measures, before we get to the point where we have to throw them in the pool.
Exactly. That's really important. So the warning sign of heat exhaustion. Kids may be cramping. Kids may just be extremely fatigued. They'll be real tired. They're nonspecific symptoms. They're nauseous. They're vomiting. Those can be signs. They have excessive sweating, or they have that flushed look beforehand. That's a time, pull them in the shade. We also ask it that our trainers even get some set of vital signs, because the vital signs will give us a hint too. So check a heart rate and a blood pressure. When we have these kids early on, they'll be flushed and hot. When we get them to the later stages, they'll start having the rapid heart rate, the blood pressure will drop, they're disoriented, they're confused, they start having some of those neurologic symptoms that you're talking about, disoriented and confused, rapid breathing. And when they get into those situations, that's where we check a temperature. If they're over 105, if they're disoriented and having any neurologic signs at all, call 911 and rapidly cool these kids.
Joe, when these kids are going to a football practice or marching for a couple of hours in band camp, cheerleading and football, cross country, should we fill them up with water before they go to these events? What are some preventatives maybe that you would recommend for these kids before they take part in a heavy activity?
Of course, a really key question is hydration would be pre-hydration, during the practice, and afterwards. So pre, during, and after, all 3 times. After is a great time to rehydrate and build them back up. During the event and beforehand, they should be hydrating. Of course, we talk about there's a few physical signs during the week of this. Is we check weights. It's a very simple, objective thing to check daily. And when kids are down 2 pounds, down 3 pounds, down 5 pounds over the course of a week, that's water weight, and they're getting dehydrated. And pull that kid out. Again, trainers are really key people. They check weights often twice a day this time in the high school setting. 2-a-day practices. May be a very early morning practice or a late night practice. Try to stay out of that heat of the day. 10 o'clock to 4 o'clock heat of the day practice really makes more sense to practice early and late. Check the body weight. You're going to see that creeping up on people. Check the urine color. A lot of times the urine color becomes very intense yellow, very concentrated urine, and these kids, and so we actually have color charts on the wall where kids are in the restroom when they are urinating to see if they're getting to that darker yellow color. It's a sign they're getting dehydrated. Particularly if kids are sick, if they're throwing up or they're sick for other reasons, those are kids at risk. Other kids at risk are going to be kids that are on different medicines. There's different medicines that hydrate kids, and so we need to avoid that. We've talked about avoiding caffeine. We certainly don't want to dehydrate during this period of time, so the energy drinks are out. The kids that are on stimulants and other things can only make this worse sometimes if those are medicines they have to take. So there's a lot of things in the prevention area, but I'd say 2 of the ones that we need to institute is looking at weights daily and looking at urine color. Those are 2 things that help us a lot.
And finally, we talked about water, and I think it's important to talk about water, sports drinks, energy drinks.
Yeah. So sports drinks, this is something that we get into with the marathons and the heat and the long distance running, is a thing called hyponatremia. So some people have gotten so in tune to hearing us talk water, rehydrate, and they're taking only water in events that are over an hour and a half, 2 hours, 2.5 hours. They get into a hyponatremia, and there are people that die every year at those races in the heat because they've taken only water and they have a real reduction of sodium, hyponatremia. So we do need to replenish, particularly in people that are known as salty sweaters. Yeah. And so in those people that have a lot of salt in their sweat, they need to replace the sodium. During the week, taking sodium in, using sports drinks that have electrolytes in them. Electrolytes need to be replaced if you're exercising over an hour, hour and a half, 2 hours, so that we don't get into the issues of hyponatremia. So beware of that. That's really important. So we said water. We talked about sports drinks. On the other hand, energy drinks that give you a boost. They give you a boost because of caffeine, and caffeine will dehydrate you. So no role for the Red Bull, the Amp, the Vault. Those during this period of time for these athletes make no sense at all.
Great stuff this morning, Joe. Thanks for coming in. And remember, parents, grandparents, and folks listening, those fall sport activities kick in overdrive on Monday. Take what Joe had to say and put it to work in your family. Thanks, Joe.
Let's save a few lives. Okay, Ray, thanks.
You got it. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.